Hi, today I'm going to talk about force-fed schizophrenia. There are three different kinds of force-fed schizophrenia. So, a person who floods their system with dopamine by way of illicit drugs, they're going to exhibit symptoms of schizophrenia, which means they're going to sometimes they might have visual hallucinations. That's not very common, but primarily auditory hallucinations are very common and psychotic thinking, psychotic behaviors. But when you take away the illicit substances, the person's symptoms of psychosis disappear. But what happens, I guess, after years of drug abuse, the person will, I guess, exhibit symptoms one too many times and they will ultimately be labeled as a schizophrenic. And schizophrenia is generally uncommon. It happens or it's expected to happen with 1 out of 100 people for the most part. And we're talking like the bell curve. So when you look within the bell curve, I'm not talking about special circumstances. When you fall within the bell curve with like regular schizophrenia cases, the 1 in 100 people, usually they'll develop symptoms towards the end of high school or in the beginning of college, right around the time they're transitioning into adulthood. And it's really tragic because that is when a person's life is starting to blossom and they're spreading their wings, encounter the world as an adult. And it's very tragic. And there's three phases that occur. There's the prodromal phase, and that is usually misdiagnosed as depression or just a lot of isolation. Then there's a psychotic break, the acute phase. And that's usually when the person ends up in the hospital with a diagnosis. And then there's aftercare. And schizophrenia is a chronic illness like any other, and it can be managed successfully in the community with the right support.